Hey, so this is episode 2 about just any tips I have for nursing school, right? We are going to be going over some test taking strategies in future episode, but this episode is understanding the testing process in nursing school. So, and it's kind of surprising when I talk to students about this because many times they never heard it and they've never heard it explained to them. When I was in nursing school, no one explained it to me. It wasn't until I was in actually going into teaching and actually tutoring with NCLEX that I really began to kind of dig a little bit deeper into this concept, and that is Bloom's taxonomy. So maybe you were a student like myself who did really well with all your prereqs, your anatomies, your microbiologies, your science courses. You were really good about studying and memorizing the content and then, plopping it out onto the test, right? You memorized, right? And then you got to the test and you knew what to pick because we'll say it's anatomy. Well, you knew where the humerus was located. You knew how ATP was made. You knew, the mitochondria, what it did. Like you memorized, right? So it was easy to just apply what you memorized, right? Well, plop it, what I call just dumping, right? You memorize, you dump it out onto the test. Nursing school is different, and this was just for me, from my personal experience. I remember when I got to nursing school, and I was really good. I was a really good student, y'all. I had almost a 4.0 GPA when I got into the nursing program. I think it was like a 3.8. And nursing school leveled me pretty hard. And that's because it was just, I had never been tested like that before. I would like read the material and memorize, and then get to the test and think, what the crap? This isn't what I read. This isn't what I memorized. I don't understand. It was horrible. And it was I went from being like a B student very quickly to being a BC student. It leveled me pretty fast. And it's all because of Bloom's taxonomy. And had somebody explained this while I was in nursing school, I might could have had a light bulb moment. So what I'm hoping is when I explain to you Bloom's taxonomy, and this is how all your nursing exams are set up, this is how ATI is set up, this is how HESI is set up, this is how NCLEX is set up, that maybe that will help you during your studying, okay? Because it's going to require you to do more than just read, memorize, and then hope for the best when you get to the test, which was what I was doing, okay? So Bloom's taxonomy first, I'm going to just really quickly share my screen here in just a moment so you can see exactly what I'm talking about, okay? So this is right here. This is Bloom's taxonomy, okay? And you'll see that at the very, it's like it's almost like a pyramid like Maslow's. You'll see at the very, very top how you have create. At the very, very bottom, you have remember, okay? And then you have understand, apply, analyze, evaluate, your little middle section. When you're in nursing school, you have to know how to critically think. They are trying to develop in you critical thinking skills because when you get into being an actual nurse on the floor, you have to know how to use critical thinking skills, right? So you'll see at the very bottom, you have remember and understand, okay? And that was great. You could memorize information, you could understand, you could explain the concept, like memorizing what the mitochondria does in the cell, and you understood it and you could explain its process. So that's the very bottom of this learning pyramid, so to speak. What nursing school does, and what the testing system does, is it no longer wants you to just memorize and understand. It expects you to already have that down, okay? You're not going to get a lot of what I call information dumping questions, right? Where you're just selecting the right answer, okay? Um, you're being now tested at the application and analyzing level. So the application, the use of existing knowledge in new context, okay? That's going to be like that clinical practice, right? That's why you have so many clinical scenario case study questions. Analyze, explore relationships, causes, and connections. That's your compare and contrast. That's your select all that apply. That's your can you distinguish this disease process from another disease process, right? So it is this application and analyzing skill. Now, when you get to the NCLEX, these are going to be the bulk of your questions. You're not really going to get too many evaluate questions. I've heard some people say that there's no evaluation questions on the NCLEX. However, I don't feel that is true. I feel like anytime I've used Saunders when tutoring students, I do see evaluation sample questions on there because using that assessment process and nursing judgment process, I do see that on there. So I just wouldn't say it's not your bulk. Your bulk is going to be your application and analyzation. You're not going to necessarily see the create. That's at the top tier of that nursing learning. I don't never see create until you're getting into like your grad school doctorate programs. I'm going to stop sharing this now. So that's Bloom's taxonomy, right? And so now you are required to take the information you know. Say you memorize that sodium of the electrolyte, right? Is 145 to 145. 135 to 145, excuse me. Very simple, easy to remember, right? But you're not going to get a question that says, what is a normal sodium level, right? You're going to get a case study that has a slew of electrolytes, right? And the patient has Cushing's disease and they've been started on this new medication. And what are the potential side effects, right? That's the type of question you're going to get to where you really have to analyze what you know about sodium, how it relates to Cushing's and all these, and this new medication this patient has started, and then apply that knowledge. So when you are studying, okay, and we're going to go over next episode a lot of study tips, but when you are studying, when you are reading this information, right, when you're in class, this is why class participation is so important. So important. I can't stress that enough. But when you're in there, you want to be asking yourself, not necessarily like, why, or not, excuse me, not necessarily memorizing the information, but why is this the case? Why? You're going to ask yourselves why a bunch. Okay. I'll give you an example. All right. So say you have a patient. Let's give you an example of a why. You have a patient and they're on the cardiac unit and you're looking at their EKG because they're hooked to the monitor and you see that their T wave is extremely peaked. And you're like, huh, that's abnormal. Why? Right? It's not enough to know that that is caused by a high potassium level, right? It's not enough to know that what a normal range potassium level is. What you need to know is here's a normal potassium range when you're studying. Here's a normal potassium range. What happens when it's out of range and why? So you're going to be asking a lot of analytical questions when you're studying. You're going to have to do a lot of digging and you're not in it by yourself. Ask your teacher. These are great. Like when you're studying, when you're skimming through your PowerPoint and your notes before or your textbook before you go to class, this is a great time to like ask the instructor why. How? Can you clarify? I don't understand. Okay. And they should be able to do that for you, help you out. Let's give you another example of how Bloom's taxonomy works, right? As far as like when you're studying, okay? So say we have a patient with dyspnea, right? And which is a sign and symptom of heart failure. Okay, we don't need to mismemorize that dyspnea is a sign and symptom of heart failure. We can't stop there. You need to be asking follow-up questions like, what is dyspnea? Shortness of breath. What does it look like in a patient? Okay. So gasping, irregular respirations, irregular rate and rhythm of respirations, elevated heart rate, pallor, low oxygen saturation, restlessness, anxiety. Okay. How do I assess for it? Right. You're getting in deeper. How? What? Why? Vital signs, respiratory assessment. How do I treat it? Okay. You're going to elevate the head of the bed. You might have the client lean forward. You know how they do that nice leaning forward over a bedside table, right? It helps helps get oxygen easier into the body. You may apply O2. Treat the root causes of the shortness of breath. Okay. Example, if it's heart failure, client may need an IV LASIK push, right? That's going to be different if the shortness of breath is chest pain. You're not going to do IV LASIK push if it's chest pain, right? You may be given morphine and nitro. So, so it's going to be asking yourself a lot of questions besides just memorizing the information. So you might be thinking to yourself, well, how the crap where do I start with this? Read your case studies, okay? In your textbooks, case studies are wonderful to read. You've already learned the information, right? Like you've already learned dyspnea is a sign and symptom of heart failure. Read the case study on it, okay? Because that's going to get you thinking analytically. I can't emphasize this enough with students. Practice those NCLEX questions. If you have a good test bank, which I know there's NCLEX assignment questions due, but get really good at reading that question and reading the rationale as to why that is like the correct answer or whatever, because that's going to get you thinking critically, like, oh, I wasn't even considering that. Like, of course, that's that answer. You know, it can be something really, really simple. And we're going to go over sample questions. And upcoming episodes, I want to do a bunch of those, a big series on those. But that's the reason why nursing school sucks. That's the reason why it's so hard. It's because it's Bloom's taxonomy, because they don't want you just to be able to remember information, right? They want you to be able to apply it. They want you to be able to analyze it. They want you to be able to evaluate it. Because when you get on the floor at a hospital, people do not fit in boxes, and somebody is not going to be this textbook perfect example of chest pain, or this textbook perfect example of heart failure, right? You're going to have to really, really critically think, and eventually that will turn into nursing intuition, where you're just like, you know, those nurses, you've probably seen them at the clinical site, where they have this patient and everything seems to be going just fine. And then all of a sudden they're like looking and they're like, something's not right. And nobody else may not even see it, but they just know. They just know something's not right. And then come to find out, patient had, I don't know, a pulmonary embolism or something major, then they caught it. That's nursing intuition, and it is developed through critical thinking and application of this material that you're learning. Okay, so that is Bloom's taxonomy. So when you are studying, read your case studies. Ask your professor how, what, when, why. Do follow-up questions to get more information. So because you're going to have to start thinking beyond memorizing, you know, sodium levels or electrolyte levels, memorizing signs and symptoms. They already expect you to know that. That's what sucks. They already expect you to know that. you gotta go further down the line. So hopefully that kind of at least explains the testing process and why um it's challenging. It was extremely challenging for me, and it took me 2 semesters to figure it out through trial and error how to critically think. And my grades got better. There for a while, I didn't know if I was going to pass, but they got better. So that's the reason why. But hopefully, this will cut some of the trial and error past stuff down. So no, that's the reason why we're tested the way we are. Makes sense now, huh? All right. So next episode, I am going to go over some of my study tips, how to study while in nursing school. I got a lot of good tips for that. And then after that episode, we're going to go straight into test taking strategies, which I love. And it's going to be a lot of fun. And hopefully this is going to benefit you greatly. All right. See ya. If I can stop this recording.